document and present their process in a manuscript and get feedback on target journals. So thank you so much for being here. I will hand it over to you, and I will introduce Dr. Szeszulski after you finish.
So I am just going to get my screen shared. Brittany, do you want to start for just a second while I get this set up?
Well, hi, everyone. Thanks so much for the opportunity to share a little bit about this project. We're mostly going to talk to you about our process for the adaptation work and trying to kind of pull together a couple different frameworks, right? D&I Science loves their frameworks, so we had lots to choose from. And so we'll get your feedback on maybe how best to utilize those frameworks for the sake of the paper.
All right, can you see the portion of the, can you see the slides? Okay, perfect. All right, so you've all gotten the brief intro in the title, so we'll go ahead and jump in pretty quickly. I do want to acknowledge the funding that has supported this work, in part from USDA, the United States Department of Agriculture, the Institute on Food and Agriculture, and the Substance Abuse and Mental Health Services Administration. So when we started this process, we really went through and identified this is a planned adaptation. And it's not a cultural adaptation. So we kind of scoured the literature. And if you were at that other presentation that Borsika mentioned, I kind of talked about this process, the challenge of how do we go about this and using all of those frameworks that are available. So we followed Szeszulski's kind of key adaptation steps to really inform our planning process and how we were going to pilot our program adaptation. So I want to walk you through some of those steps. As far as community assessment, our state has a long history of the Strengthening Families program for youth 10 to 14-year-old being implemented. We have experts in the state, key trainers, key nationwide and global trainers. So we had a lot of capacity already, and this is really focusing on the kind of community assessment process. At the state level, there's a potential for sustainability of the program due to the state funding. And so we knew this was one that was already approved and identified as an evidence-based program. So it flowed nicely with that. And there was local need expressed by families and communities that they liked the program. But they also acknowledge we live in Washington State, we live in a context of legalized cannabis. And we're really curious about how do I talk to my youth about that? How do we as a family talk about that? So that was really part of the need for doing this process. So we understood that and we went out and found some funding. And I don't say that lightly, it is a lengthy process, but we obtained funding to do this program adaptation. The intervention selection, like I mentioned, we already had capacity and strengths in the state of implementing SFP 1014, I'll call it for short. So it wasn't a process of identifying an intervention or selecting an intervention. We were going with one that we had already, were very familiar with and had already worked with. To move along in this process, we did consult with experts. So Iowa State University are the developers of SFP 1014, and we engaged them about the process. But what we also found really helpful is consulting with some of our key partners. So in this planning process of what should an adaptation look like, what would be most feasible, what content would you want, we did virtual focus groups because these were done in summer of 2020, virtual focus groups with family members or caregivers who had gone through the program, as well as facilitators who had facilitated the program. And that really informed what we would be adapting. And one piece of information is this program is implemented or delivered in both English and Spanish. And so our focus groups were conducted in both English and Spanish or with Spanish-speaking families and facilitators. So that all informed what we feel like needs to be adapted. And we're going to talk about this. Brittany's going to talk about an example of this process in a moment. But it really was a very collaborative process. In the intro, you heard that both of us have extension appointments. And so we work very closely with our community partners throughout the state of Washington, especially in extension. What we found is that there was really a focus to leave the bulk of the program as is. And the adaptation, sorry, this is a spoiler, Brittany, but the adaptation was to add on extra time to each session, except for the youth session. So we can get into that in a moment, if it makes sense. So then we went through the process of adapting the program. We developed training materials. We developed a curriculum kind of supplement that goes along with, and it really mirrors the format and look of the original curriculum. And we trained staff. We chose experienced facilitators, not brand new trained facilitators, to do this adaptation. And then we tested the adaptation material. So this gray box is where we are now. We're looking at a process to document the not only these planned adaptations that we have documentation for, but now we've facilitated it. We need to document these reactive adaptations, or what emerged and what are facilitators and family members saying about the adapted curriculum, and how do we move forward with that? So I'm going to, oh, and the other pieces, we have some pilot data that looks really promising, or it's really so far looks equivalent or similar to what we see for in-person standard delivery of SFP 1014. So that was a really quick overview following these key adaptation steps, but let's give an example of what this process has looked like. So I'm going to introduce these frameworks that we use, and then turn it over to Brittany to talk about an example. So we really were guided by FRAME, the Framework for Reporting Adaptations and Modifications Expanded, to help us document what we're doing and the why of it. So this has been really helpful in getting to the details of how do I document and report on these adaptations that we're making that are planned. But we also really appreciated the model for adaptation design and impact that was built on or expanding some of this work to talk about adaptation characteristics and some of these mediating or moderating factors that may inform the outcomes that we're seeing of our adapted program. So I know that's added frameworks kind of thrown at you, but here's an example of what this decision-making process would look like based on Maddie. So, the decision is the adaptation that I have really a thoughtful adaptation with the goal in mind that it's similar to, aligned with the core key components, the core functions of the program, yes or no, and you can kind of walk yourself through this decision tree. So here's an example, and I'll turn it over to Brittany for what our adaptation process looked like.
Thanks, Elizabeth. So yeah, we went through a couple of different iterations and ideas, and fortunately we had a really good group of not only researchers and people, from the D&I science world, but the folks on the ground who implement this program and know it in and out, and are master trainers in it. So we actually first threw out an idea about, well, why don't we add an entirely new session that's focused at the end on cannabis? They quickly said, nope, that's not going to work. We have a hard enough time getting the youth and family to come 7 weeks in a row. Adding a whole nother week, it's going to be too hard to engage them. So instead, as Elizabeth alluded to, we proposed back to our partners, how about if we add just 15 minutes onto each session? And they were open to that idea. So the other key part here, and I think Elizabeth also alluded to this, is that there are both youth specific sessions and caregiver specific sessions. And then there's a family session portion of the session where they come together. So youth and their parents come to this program, usually in the evenings after school, and they split up for the first part and have youth and caregivers separate, and then they come together as a family at the end of the session. And we had some discussion about what the added content might look like. For the caregiver session, they really, based on feedback, really wanted cannabis specific content. How do I talk to my youth about cannabis in the context of legalized use among adults? For the youth sessions, we decided, for a variety of reasons, partially developmentally, we have youth as young as 10 years old all the way up to 14. And also what the literature, preventive science literature, suggests is that we didn't want to give them very specific cannabis substance related information because there's some risk of iatrogenic effects with that. So instead, we added some more general substance use related content. And if you have questions about that, we can answer them. But we did use these very general principles to help guide the additions, because again, we wanted to be in line with what the stakeholders were asking and what the literature suggests is most effective. So adding new content and resources that were in alignment with the content for that session. So we didn't change the theme of that session. We just kind of built on it, which again was, I think, better integrated with the core components of the intervention. And any new content and resources, again, were also in alignment with feedback from facilitators and caregivers, which we had already conducted those focus groups. So we had that to look back to. And then like the last bullet says, making sure that any of the additions that we included did not include elements of ineffective programs, because the other piece we did in addition to the focus groups was we conducted a literature review to say, okay, substance use prevention programs generally, what are the key components to effective programs? And then also what does research show are potentially iatrogenic or ineffective? So we used all that information to guide the choice of the adaptations that we made. Next slide. I think there's one more slide. Yeah. So I kind of, again, alluded to this, but using the Maddie decision guide is helpful because, again, it just puts these things right in the forefront of your mind as you're making these decisions. So that first decision, you know, is it systematic? Is it designed with a goal in mind, aligned with core functions? We could easily say yes to this example because we were able to do this very systematically and in partnership with our key stakeholders who knew the curriculum very well and the core components. The examples on the right-hand side just give you kind of a very specific example of what we did to add 15 minutes of content that was specific to the caregivers session and the youth session. And again, in alignment with the theme of that session already. So the next question being, are there any negative impacts on the outcomes predicted, intended or unintended? At that point, when we hadn't implemented it yet, we didn't think there'd be any negative impacts. So we answered no to that question. So we did proceed with the adaptation. One more click, I think. And then right now we're in the midst actually of reviewing all the pilot data and assessing whether, you know, these adaptations were in fact, you know, successful or potentially had unintended or, you know, unexpected negative impacts. So we're reviewing the data right now to try to decide how to proceed if we're going to continue to tweak or keep the adaptations that we already have. Hopefully that was quick enough. Elizabeth, go ahead.
Yeah, I know this is a fast process. So we went through a lot of information in kind of a short amount of time, but we really did want to bring some key questions. This process is new to our team and our group. And so here are some questions that we brainstormed that we would like to have feedback on, and I can put them in the chat in case it's easier to see everybody, but how do we merge these frameworks thoughtfully? We've tried to choose ones that build on each other and complement, but is there any general feedback on where we've gone wrong or gaps you see or what's gone well? You know, sometimes we are so enmeshed in the process, it's hard to see what was a good choice. We think we made good choices, but you know, what are the main contributions? It would be interesting to hear that from the outside. And then how to frame this for publication. We're starting to write this up, and how much do we talk about outcomes and include outcomes versus focus predominantly on the process, for example. So I can copy and paste those in the chat, and I'll stop sharing for a moment.
Thank you so much. Really good example of how to quickly get us up to speed. I will let everyone start to use the chat if you would like to add some, and also feel free to unmute yourself if you have responses. Since we have a short time, I recommend that the commenters just address any of the questions that were posed, so you don't have to go in order, and feel free to jump in. And Russ, you had a question. I wanted to start us off quickly, that you would be interested to know how the developers of the programs reacted to the idea of adaptations. Do you want to jump in and ask that actually?
I can. Brittany's already, again, I encourage everybody to use chat here. It maximizes our time, but Brittany's already answered it, at least most of it, I think. But it's just, I don't know if my experience has been idiosyncratic, but it's been tough for me talking to many program developers to get across this idea, you know, of function and form, and that we want to do that, as opposed to rigid adaptation to a protocol. And I don't know, it's just been a difficult conversation, and often just developers are absolutely convinced that if you change anything, you know, on it, that's going to have adverse consequences, you know, to Fidelity. So I don't know if you had any of that or your strategies. I totally get it that having an ongoing relationship would help. And I'm just wondering if at all, this is both a general comment and about interacting with them, if you had any discussion of changes, you know, to the what, to the intervention versus the implementation strategies that you use for how to deliver that, if that came up at all or not.
I will say, or I'll at least touch on the developer piece. So in addition to our our state master trainer having a great relationship with Iowa. We did talk with them initially about wanting to adapt this and had a similar reaction to kind of what you said, which is that, that's not the recommended course of action. It is kind of the general feedback. I do think, to Brittany's point, that we really aren't changing any of the curriculum. We're kind of adding to it. Hopefully is helpful, but yeah, I don't know, Brittany, if you have anything else to add.
Yeah, I think that we promised to keep them in the loop too. We are in ongoing conversations with them, sharing feedback that we've gotten through the pilots. And like I said in the chat, I think it helped that we weren't removing any content. We were just adding to the end. We weren't changing how it was being delivered in any way. So that helped a lot. And in terms of implementation strategy, I don't think we've really made any adaptations to the implementation strategy unless you count kind of the changes to the training or the additional training and support that we added around that cannabis specific piece. But otherwise, again, we actually went back and forth about saying, like, is this really an adaptation? Like, or are we really, what qualifies as a true adaptation? It felt like we were really just tweaking it or supplementing it. So that was, yeah, still up for debate, I suppose. And thanks for all the great comments and feedback. I don't know if you've seen this already, Elizabeth. This is really helpful. Thank you.
Yes, I'm trying to take notes on
and
some of these.
Kara is also trying to save the chat so she can send it to you in case you are not catching up with everything that is being shared. Let me see if anyone else wants to quickly jump in with comment. And I'm also trying to browse the chat. So I would just say that your question about what counts as an adaptation has been a major focus of mine and many of our colleagues, because you can be very minuscule and any little change would count as such. And then when we work with others who are less into this whole adaptation geeky thing, they might be interested in documenting only just bigger adaptations. So I think that providing a definition, how you defined it in your project, what you count as an adaptation, would be very helpful for the field as we start to, not necessarily there's a standard definition, but I think it would be good to start to see that people define what accounted for an adaptation.
Borsika, I think it might be, if she's able, interesting to hear from Danielle in terms of her comment on merging the frameworks. So I know that's one of the key questions that Elizabeth and Brittany had, and might be worth discussing. So I think there are some issues. I don't know if there's one right way to do that, but I think it's an issue that reviewers often have for both manuscripts and grants about your rationale for and how you did that. Most, but not all people think that often that's itself, a good adaptation to a framework to do that, but not everybody does. And I think it is, from my perspective, more art than science today.
Yeah, thanks, Russ. I had a similar issue when I was writing my grant on using two frameworks and how do I convince reviewers that both are useful and important. So I was reading a lot in dissemination implementation science literature and saw that people couched merging frameworks as, like, if you have one framework that is a process framework, so like Maddie, where it's really guiding the process of how to make adaptations to this program. And then a second framework that's really about evaluation or like documentation. And I feel like Frame really fits that nicely because it's really just documenting which adaptations were made, when they were made, what the outcome was from making that adaptation. And so I did that in my grant successfully. It got funded, and it wasn't with this adaptation in mind. It was with two other frameworks, but I feel like couching it that way can be really useful for explaining why you use both and why they're both important.
Thank you. That's helpful.
Thank you so much, Danielle. I see a hand up, Zoom user, but I don't have a name. So if you identify as Zoom user, please unmute yourself and just come on.
Yes, I'm sorry. It's John over at Byte here.
Hi, John.
Very quickly, first of all, congrats in very clearly presenting that in such a short time, and really useful and interesting. One specific question is involving different stakeholders or any in assessing the outcomes. And then the second question is, at the moment, we're struggling with, we want to give the readers of the report some kind of indication about how certain we are that certain changes resulted in certain outcomes. And we've been looking at different evidence grading or other scales, and that's not really the best way. But that would be both how certain you are in your settings and situation, but also guidance to them about if they did similar things, would they see similar outcomes? And I don't know if you have any quick responses to any of those questions. Thank you very much.
Thanks so much, John. Brittany or Elizabeth?
Well, one thing that we're doing in terms of the evaluation piece, I'm not sure it's going to exactly answer your question, is, again, we mentioned we've had a long-standing history of implementing SFP actually and evaluating it at a state level for a number of years. So we have a large data set of 500 plus implementations of SFP, traditional SFP, that we are, and we have similar measures collected in this cannabis adaptation. So we have some ability to compare, or at least to take a look at, is the engagement level of caregivers and youth the same or not, with this new adapted version. And again, it's not like a statistical test necessarily. We won't be able to say statistically that things caused this adaptation caused these changes, because it's not, randomized control trial, but we do have some degree of comparison, which I think is fortunate in our situation. Same thing with the outcomes. We could make some statements about if the outcomes for the caregivers and youth are similar to what we've seen in the traditional implementation of SFP.
Maybe I'll
go ahead.
There was another piece of that, which is about involving stakeholders or involving our partners. And so I can touch on that briefly. So, our extension partners, the one who identified as a master trainer, we have community facilitators. They have been involved in the process all along, from the beginning to us hearing and having a discussion about what they're hearing in the communities, what families want, matching that with kind of our understanding of the climate of cannabis in the state of Washington, all the way through each adaptation step. We actually just met last week to talk about what were the facilitators and family members requesting as far as adaptations of the pilot, to make kind of a decision of how do we move forward and which are the key adaptations we need to be considering and what's the process for that. So I think in that sense, we're involving them throughout the process and all the way through to publication for those of them who are interested in being a part of that. I don't know if that's helpful.
So I believe we have to switch at 9:30. So let's see whether there are any additional recommendations, answers to the questions. Yeah, great additions in the chat as well. Thank you so much, everyone. What I'm going to do, please continue to send any recommendations via chat to Elizabeth and Brittany. Thank you so much for doing the great example of how to do this very briefly. And I am going to introduce Dr. Szeszulski, and I don't know if you are pronouncing your name well, Jacob. Would you mind to help me?
Yeah, the Z's are H's. It's Szeszulski.
Szeszulski, okay, because in Hungarian, SZ is an S, actually. So that's where I was cheating there. Okay, very good. Thank you so much. So let me provide a brief introduction to you. Dr. Szeszulski is an assistant professor in the Institute for Advancing Health through Agriculture at Texas A&M AgriLife Research. His primary research interest is in the development, implementation, evaluation, and dissemination of school and community-based physical activity and nutrition programs for youth. Specifically, he is interested in understanding policies, systems, and environments that affect youth physical activity and nutrition, identifying organizational and contextual factors that affect the delivery of school and community-based programs, and using community-based participatory research approaches to reduce disparities in youth's health behaviors and subsequent health outcomes. Currently, he's a principal investigator on school-based projects funded through the American Heart Association and National Institute of Minority Health and Health Disparities. He is going to be presenting on his work, Strong Teens for Healthy Schools, using evidence-based intervention mapping to adapt the Adult Change Club for middle schools. And I will let him say more about this. Thank you so much. He's looking for feedback on methods and next steps. So thank you for being here, and I will hand it over to you.
Great. Thanks for the introduction. And I think this is a really interesting presentation to pair with the first one because it's at a very different stage in the process. Let me see here. Are you getting the right view of this, or do you have the one with the arrows?
We have a non-presentation mode set of slides with the, kind of the slides, thumbnails on the left, and then the main slide in the middle.
Yeah, how do I switch this?
This is now the presenter mode. And you are welcome to also just leave it in normal mode without doing it presentation. We have done that before if you make the slides big enough, so you don't have to worry about this.
Yeah, let me just do that because I can't find a way to switch it.
Without taking too much time, someone just recommended click display settings and switch. If you can do, if that makes sense, or if you can find those quickly, display settings and switch. But like Borsika said, if not, that'll be fine, what you have now.
Okay, I'll just go back to the other one for now because I can't seem to find it on the fly here. All right. Okay. As you said, I'm going to be talking about evidence-based intervention mapping and how we're using it to adapt a curriculum. There's also a co-PI for this study, MPI for this study, Alexandra McMillan-Uribe. And so I wanted to acknowledge her as well. A couple of funding acknowledgements. This project's funded through the Institute through Advancing Health Through Agriculture. We got some pilot funding for that, as well as it's recently been funded by NIH, NIMHD as an R01. I also want to acknowledge all the research team who's helped with this adaptation process and many of the collaborators at UT Health. I see Pat Mullins on, as well as Maya Foster. They had a big part, they developed this methodology, so the adaptation wouldn't be possible without them. So I want to take the time to acknowledge them.
Thank you.
So quickly, what is EBI mapping? And this is the pre-read that I had sent out for this presentation. So if you got a chance to read that, you'll have a lot more details on it. I'll go through it briefly. It's a systematic process for understanding EBIs that's based on intervention mapping thinking. And so on the right there, you can see the book, Intervention Mapping, Planning Health Promotion Programs. It takes a lot of thinking on how to plan interventions and has applied that to adapting interventions as well. This process, EBI mapping, comes from a larger process called IAM-ADAPT, which is an online tool for completely adapting an intervention, where EBI mapping focuses a little bit more on understanding how the intervention works. So I think this is probably a little bit small, so I'm going to blow it up quick here so people can see it. This is kind of the different tasks for EBI mapping. And so in the first task, you go through and you would document all of the materials for the intervention and who they're for. And then you look through each of the intervention materials in task 2 and identifying what are the health problems, health outcomes, behavioral determinants, methods to change those, practical applications that are used. And you do this for the individuals who are the targets of the intervention, but also people in the environment who are trying to change environmental conditions that affect the people in the interventions. Then there's also a piece of this that looks at how the materials are designed and developed. So describing design features, delivery channels, implementers, implementation strategies, and needed resources. For this presentation, I'm really going to focus on tasks 2 and 3, and really for the at-risk population. So documenting health behaviors, determinants, methods, and practical applications. But just know that this is part of a larger process that we've used to adapt the intervention. So when you use this process, it can help you develop a logic model for the intervention if one doesn't already exist. And then it can also help you develop a logic model for the adapted intervention. And when you compare these two different logic models, you can start to systematically see the differences between the original intervention and the adapted intervention. Down here highlighted in the blue, you can see what the logic model looks like. On the far right, you have the health problem, the health outcome, the behaviors that affect that health outcome, in this case, physical activity, nutrition behaviors, as well as environmental conditions that affect those health outcomes. Individual personal determinants that affect health behaviors. This would be things like knowledge, attitude, self-efficacy. Then you also have personal determinants for environmental change agents. So in a school-based intervention, this would be a teacher, and a teacher has things that affects their behaviors like attitudes, knowledge, self-efficacy, and affects their ability to change environmental conditions. And then the practical applications are the activities that are actually in the intervention that are used to make these changes. So the intervention that we're adapting is called Change Club. It's a 24-week intervention that aims to improve health behaviors and outcomes in rural, underserved communities. Basically, with this intervention, a small group of residents meets regularly to change their community environment relative to food or physical activity opportunities by following a civic engagement process facilitated by an extension educator. And so some of the activities that have been done is things like installing more walking trails or working on restaurant policies or things like that. So really this is whatever the community residents are interested in changing within the physical activity or food environment. They follow this structured process to get them to change an environmental condition. The larger project is funded through NCI, and the PI for that is Dr. Seguin Fowler. The adaptation we're calling Strong Teens for Healthy Schools. This is very different from the previous one, as I said, is because this is it's a major overhaul adaptation and kind of opposite of what they were talking about earlier. I'm not sure if you could even consider it an adaptation. It might be too much of an adaptation that it's whole new intervention. But we tried to maintain some of the core ideas from that intervention, and so we're calling it an adaptation. As you can see, we're adapting from adults to adolescents, rural communities to middle school 4-H programs. We're going from English to English and Spanish. We're changing behavioral theory from social cognitive theory, which was more important in adults, to theory of planned behavior in children. The cultural context, it was 95% white rural communities. We're adapting this for urban, 40% economically disadvantaged students, greater than 40% Black and Hispanic students at the school. The one thing we're kind of keeping the same is the 24 sessions, although we've tried to create some flexibility in that because we've made it so it's easier to implement and that it can be delivered in 2 30-hour modules per week or 1 1-hour module per week for 24 weeks. So we've tried to make it more flexible to fit in a school setting. So the way we did the adaptation process is through EBI mapping. I quickly just wanted to put these resources up there. And this is, so this is I Am Adapt. If you want to use this, there's one resource you can use to do the adaptation the way we did. There's also EBI mapping. And then we also developed, as you saw a second ago, a spreadsheet that can help with that adaptation process. So once we go through the whole adaptation process, I want to talk a little bit about the changes that we saw. On the left is the Change Club, on the right is the Strong Teens intervention. And so once we mapped out the whole intervention for the Change Club and the whole intervention for Strong Teens, we can start to compare what changed in behavioral determinants. So on the left, you can see that the original Change Club intervention emphasized subjective norms, skills, self-efficacy, and knowledge. Because we were using the theory of planned behavior, we tried to add some more stuff related to attitudes, perceived behavioral control, and social norms, which are the constructs of theory of planned behavior. So we tried to add more activities that directly target those constructs, although you can see that some of the stuff that was in the original curriculum also got carried over. So we had 25 practical applications that target knowledge, 10 that targeted self-efficacy, 28 that targeted skills, etc. And so the numbers here are the number of applications that targeted each construct. Now, these aren't always a one-to-one thing, so one application can target multiple constructs, but this is kind of a summary of how many times each of those determinants was targeted, both in the original and in the adapted intervention. We also looking at methods here. The major ones that were used in the adult version were advanced organizers, discussion, goal setting. In the strong teens, we did a lot more participatory learning. So we used some active learning and some participation activities. We cut down some of the discussion, some of the goal setting. That I think is part of not using social cognitive theory as much, is why the goal setting went down. And then we also cut down to advanced organizers as well. For the applications or the types of activities we used, there was a lot of breakout pairs, discussion, and lectures in the original curriculum. In the strong teens, we focused on discussions and a lot of small group or whole group activities. So again, focusing on some of those norms and about what your peers are doing, we felt discussions and group activities were a better way to do it. So we focused more on those and the types of applications we were using. We've also created heat maps of what methods were used to target which behavioral determinants. And again, I know this is kind of small, so I'm going to see if I can blow one up here for you. This is the original intervention. And the way you read this is along the top are the methods that were used, and going along the left-hand side are the determinants that were targeted. And so you can see here, advanced organizers was used 37 times to target knowledge as a determinant. Same thing, discussion was used to target knowledge 30 times. And so this helps us start to understand what are the theory-based change methods that we're using to change these determinants. Along the right here, you can see all of the methods that are all of the determinants that were targeted and how many times they were targeted, as well as along the bottom down here. You can look at all of the methods that were used and how many times they were used to target a determinant. So these heat maps provide a lot of information about the theory of how this works and which methods are being used to target which behavioral determinants. So that's the original one. I'm going to have to bring this forward. So for the Change Club one, you can see that we use active learning a lot to develop skills. We also use participation a lot to change knowledge. Participation was used to change subjective norms. Active learning, again, was used to change knowledge. So the green ones are the ones that we use frequently, where the reds or the zeros are things that weren't used very frequently. Methods weren't used frequently to change determinants. So that was the initial part of the adaptation we did. We redesigned the curriculum for rural adults, for middle school students, mostly focusing on the behavioral theory and the individual level components that are being used to change behaviors. Our next step is to do some interviews with extension agents and 4-H staff, school administrators, teachers, as well as 6th and 7th grade students. And I think part of what we're going to do in this process is really look at the cultural relevance of it. Like I said before, we're going from a 95% white adult population to a 40% Black and Hispanic urban population. And so we really want to make sure that this is culturally relevant for them, but also that they're enjoying the activities and thinking about some of those other things that might be affecting outcomes. And so we'll continue to refine the curriculum, and then we're hoping to roll it out this fall and do our first pilot test of it. So that is all I had.
Thank you so much. That was another excellent, very brief summary. I think we have a good sense. Do you have specific questions for us to discuss, or was it more just open-ended discussion?
I think it's more open-ended discussion. I think what I'm really interested in is the process that we use to adapt it. It is a relatively new process that we used. I'm Adapt has been around for a few years. EBI mapping just came out, but we're finding that it gives us some really valuable data in the adaptation process. And so I'd love to hear others' thoughts on it, what they found useful, what they didn't find useful, how they could see using this in their own work.
Thank you so much. I will say that I posted a paper earlier, Emily Treichler led that, and she used Adapt as kind of partially guiding, but not as tightly as you described it. So I just wanted to mention that paper. You will find it above in an earlier chat. I am also looking at some chat comments to start us off. Jackie, were the heat maps a working document as you were adapting? Were there goals for % of number of activities and determinants you were aiming for? I don't know, Jackie, if you want to also jump in, or you're just going to answer Jacob if you want, like.
Yeah, so the heat maps are more of a working document. We've actually gone through it a couple times. When we initially did it, we found out that we weren't targeting theory of planned behavior constructs as closely as we had hopes to. And so we went back through and thought about each of those constructs and how they were written into the practical applications and said, okay, how can we get at these constructs better in the activities that we're doing, and how can we include them in more activities? So I think we've gone through it about 2 or 3 rounds of adaptation using those heat maps, and they change a little bit each time. So yes, definitely working documents. We don't really aim for a certain percentage just because it gets a little bit difficult. One of the things that's challenging about this is pretty much all activities include trying to change knowledge in some way. And so you get skewed percentages because knowledge seems to be so high in this. So we don't aim for a certain percentage that we're trying to get. We just really want to make sure the constructs that we're targeting are higher up on the list, whereas the percentage itself really isn't all that important.
Jacob, this is Russ. Could you say a little bit more about that? I was very intrigued with that process too. What I'm wondering is, to what extent are all of the your partners, community partners and things, involved in like creating and commenting on the heat map and those processes? And to what extent do you or others kind of have that as a background with the online tool to use that to facilitate, discussions and decisions?
Yeah, it's a good question. I think I think intervention mapping has a lot of language in it that is sometimes hard for our community partners to understand.
Right.
And so the way that we're trying to use that is, especially the summaries and the heat maps are in the logic model, which I did not show because we haven't produced that all together. And I can pull up an example of that quick too. We're trying to use those as tools to talk with our community partners because I think they're a little less cumbersome to understand all the language. But I think we've almost kind of divided our adaptation process out into 2 pieces. Like the initial piece is really us focusing on adapting the behavioral theory, and they've had input on, I think, on some of the constructs that we're targeting, what they think are important in that way. And we've gotten that from some interview data. But we're also going to go back to them with the finalized curricula, which I think is what they're used to seeing. And so we're going to give that back to them, and they're going to review individual sessions, and they're going to participate in some of the activities. And I think that'll help us get us a lot more information from them as well. So we try to use the summaries to some extent to talk with them, but I actually think they're used to seeing it, especially school teachers are used to seeing it in a lot of different ways. And so I think having them engage and review the curricula and actually the way it's written and structured and alignment with Texas education knowledge standards, I think all of that has been more important from the community partner side as opposed to digging into the methods, determinants, all of that type of stuff.
Let me see if others would like to jump in with any thoughts.
Oh, I'm the one who wrote that this was kind of, we were talking about the definition of adaptations. this one pushes the boundary, I think. And so I guess in a sense, Jake, the question is, why call it an adaptation? I mean, lots of us, when we develop interventions, draw on other ideas. How did that serve you?
Yeah, so I think there's two pieces here. One, the Change Club curriculum is, the goal of the Change Club curriculum is to have residents create their own environmental change. And that really is still the key idea of this intervention, is we want students to create their own environmental change in the community. So from that perspective, a lot of the activities we're doing are the same related to that environmental component. The individual level piece, we've added a lot more knowledge pieces and trying to teach students about physical activity and nutrition, which was somewhat in the adult curriculum, but not as much. And we've obviously had to tailor that for students. I think calling it an adaptation, really part of it was because it is really trying to maintain that key idea of facilitating residents to make their own environmental change. And so in this case, facilitating students. So I think that part is really why we call it an adaptation. Also I think it served us well from a practical standpoint in getting funding, to be completely transparent. Taking an existing intervention that's already out there and saying we're adapting it for a new population, I think goes over better with a grant review committee than I'm gonna create a new intervention that I don't know what it is, right? And we had done a lot of this initial adaptation, the individual level adaptation, before we submitted the grant. So it gives us some preliminary data in a way too, and that we have all this data on what we've changed related to methods, determinants, changes to the logic model. And so we have these preliminary data and studies that are kind of out there that we could talk about as things we've already done to get it moving. So I think it helped us a lot in getting the funding for it. But I agree with you, whether it's an actual adaptation or not, I think it's kind of up in the air. We tried to keep a lot of the principles of the curriculum, but there's also a lot we changed because it's such a different audience, just such a different population.
Jacob, that makes me think about what Russ mentioned earlier, this idea of function and form, and that it is certainly an adaptation if you think of maintaining the functions, because that's, I think, what you are describing, at least how I think of it. And then the forms have changed substantially. So I wonder whether, that's an interesting discussion. What is the value of maintaining an adaptation lens versus thinking of a new creation inspired by prior work?
Yeah.
Yep. Please go ahead, Jacob.
Oh, I did my postdoc at UT Health, and Pat and I had a lot of these conversations about what is the core components of an intervention and how do you decide what those are. And I think some of what's out in the literature right now is like the investigator decides what the core components are. And they say, these are what I think are the core components. I think, are trying to push people a little bit away from that in terms of thinking about like behavioral theory and what's adapted there. But if you were to think about the core components of this as defined by the investigator, I really think that is the students creating their own environmental change. And so that is one of the core components we're trying to keep in that sense. But also, I think there's a lot of information that's changing. Like you said, the form of that is very different.
Yeah. Well, thank you so much for sharing that. You might be familiar with Monica Hoyes Perez's paper on function and form, but I really like it because she kind of connects it with some theoretical background, but then also maintains that, partner-based information. So I will drop that in. Kelly has put her hand up, so I wanted to call on Kelly.
Thanks, Jacob. What are your questions? You asked what people's reactions were to the methods you used, and I think it's just really great to see such a systematic approach to what you were calling adaptations. I liked how you talked about creating a logic model. What is the existing intervention? Then creating a logic model to map out what you think these adaptations are, and then that gives you kind of a way of comparing and being able to pull out what you think these adaptations are. And I the process of linking the theoretical change models to the target behavioral determinants for a health promotion intervention. I don't know if that came from the EBI or the IAM-ADAPT frameworks, but that was also really just, that was very cool. You stopped, I think your last slide, just you said your next step is to do interviews. But I'm curious if you, and then maybe your answer to Russ's question when he was asking you about community engagement, and you talked about sharing the logic model, maybe that's what you plan to do, but I'm really curious if you could share what you're going to be doing in that next phase, and if you have any discussion questions related to that you want to talk about.
Yeah, so in the next phase, we've developed the focus group guides already for the extension agents and the school stakeholders. And the way that we've kind of structured this is that we've decided on some key sessions that we're interested in gaining some feedback on. So there's 24 sessions in total, and we're hoping to give some of the extension agents 1 or 2 of those to kind of pre-read, review before they meet with us. And then we're asking them about the relevance, the structure, those types of things. I don't think we're going to share the logic model at this point with them, although we do have a community advisory board that we're involving as well, and we'll probably share the logic models and the other summary pieces with our community advisory board to get feedback in that way. For the interviews and the focus groups, we're really focused on the relevance of the curriculum. Is it easy to use? Is it better than what they already have? Kind of thinking of some of those organizational readiness pieces, but kind of focused on the innovation itself. And is this innovation better than what they already have? Is it relevant to what they're doing? Those types of things. So that's how we're thinking about the focus groups, as well as also kind of the cultural competency pieces of it as well.
So one thing that we sometimes when we do those types of intervention development focus groups, it's hard to get people to just really say, like, they want to be helpful. They want you to think they like what you're doing generally. And one thing that we're using that I've really started to like when we do that work is some like test or user scenarios. So instead of asking like, do you like this? Is this like showing like a case of, okay, so this could be whoever your intervention deliverer is, and you kind of create the scenario of this person. You talk about how they'd be using that part of the intervention or something. But that's, I found, I'm trying to, you know, when you get these groups together and ask people to respond to your intervention, it can be tricky because they can go in either directions. But I found those user cases can be really helpful for getting people to react and feeling like, you know, in an objective way to give you their perspectives.
Yeah, that's really interesting. We've done a little bit of that too on a different project. We've developed like some case vignettes that they can watch before doing it. And I think that was really helpful in getting feedback. With the students, we're definitely doing that. We're going to have the students participate in the activities themselves. And with middle school students, I'm sure they will tell us if they do not like it. So we get really good feedback from students generally. And we've developed a pretty strong relationship with our extension partners here. We've been working with them for 18 months now. And I think you're right. At first they were like, we like this, we want to help. And then I was like, no, tell me if it's not useful for you. If it's making your job harder, I want to know, because I don't want you to have to do something that makes your job harder. And so just a lot of those ongoing dialogues, I think, have helped get us some better feedback. But we should think about how to get some more case vignettes. I think you're right. And that they could be useful in that way, or even watching them implement pieces of it. You'll see things they skip or don't skip. And so we're hoping to get some of that too.
Thank you so much. Fantastic discussion, everyone. Thank you for being here, for the presenters to prepare and do such an amazing job making this meaningful, even though they had little time. We look forward to our next session in March. Hopefully we will see you all. And if you have ideas, again, please submit those. We would love to have you present similarly to today's presentations. Thank you, everyone. And please email us in between sessions. Thank you. Bye-bye.